All right, so that's the legal landscape. So now let's quickly talk about some of the things that hopefully, if you're an employer, your plans have already addressed. And some of these things may provide some opportunities for cost saving, but nevertheless, your plans should have already done this. You should have provided coverage for older age children up to age 26. You should not be retroactively terminating coverage. You can terminate coverage to individuals prospectively, but not retroactively unless there's fraud. I don't think that's a big issue. Lifetime limits, your plan cannot impose any lifetime limits on essential benefits. We don't yet have a definition of essential benefits. We have guidance on the fact that it's going to be based on the 3 most popular plans in the state, or a couple other scenarios, but we're still waiting to figure out what exactly essential benefits means, because that's what you can't have a lifetime limit on. And then progressively over the next several years, your plan can't have annual limits. So I think the issue that needs to be resolved there is what constitutes essential benefits. If your plan is grandfathered, which means that it existed on March 23rd in 2010 and hasn't undergone significant changes, you need to make sure that in your communications to employees, you're telling them that your plan is grandfathered. That's an important notice, because what the government's saying is, well, if your plan's grandfathered, it doesn't have to comply with all aspects of healthcare reform, and you better tell people about that. It has to comply with most aspects of healthcare reform. So those are just some of the highlights of things that should already be in place. So what's coming up right now very quickly? We have, for plans that have lost grandfathered status, there are some specific claims, appeals, and external review requirements that require that if a claim is denied under your plan, the participant has the right to pursue it, even to the point of an external review. For plans subject to ERISA, there have been claims and appeals rules in effect. This broadens those rules. For non-ERISA plans, like government plans and church plans, these are new. So if your plan has lost grandfathered status, you need to be sure you're attending to those kinds of things. Just several other provisions that we're going to skip over. Patient protections if your plan is lost grandfathered status, lost grandfathered status. Preventive care, first dollar, we're going to talk more about that in a minute because of a specific issue that is arising. But I think those are pretty well ensconced in plans at this point. If your plan is insured, you probably have gotten a check, you've either gotten a check or a notice saying you're not getting a check relating to the minimum loss ratio rules. These rules say that an insurer, and this only applies to insured plans, not to self-funded plans, not to stop-loss coverage, but if your plan is insured, the insurer has to use 80 or 85% of the premium dollar, depending on size of the plan, for health purposes. Only 20 or 15%, depending, can be used for administrative purposes. And if the insurer doesn't meet that standard, they have to rebate a portion of the money. Now, the rebate is determined on the insurer's entire block of business, not on a particular employer's plan. So that's something that has confused a lot of people. And it's the entire block of business in a particular geographic location. So assuming you get a check back, what do you do with it? Well, that kind of depends on if you're an ERISA plan or a government plan. Just simplifying some complex rules, to the extent that the participant paid for any part of the premium, that portion of it needs to go back to participants. If it's a government plan, that proportionate share of the rebate can go back either to offset or to be a premium credit in the next policy year, or it can be paid in cash. If it's an ERISA plan and the plan is a trust, the money all needs to go back to the trust. But if it's not a trust, which is very typical of an insured plan, the portion that the employee paid needs to go back to the participant, either as a premium credit or cash, or it can be used for benefit enhancements. But in order to preserve the ability not to have a trust, it has to be distributed within 3 months. So that's something that ERISA plans need to deal with. And if you want to talk more about that, that's an ERISA issue. It's not a healthcare reform issue. Another thing that's coming up very quickly is a new provision under the preventive care. So if you've lost grandfathered status, your plan has to provide preventive services, first dollar, no deductibles, no copays, so on and so forth. And the government has the right to enhance, modify, change what constitutes preventive services periodically. And so they did that last year. They provided a list of preventive services specific to women's health. One of those services is that plans must provide all forms of contraception. That is problematic for certain plans who have religious and philosophical opposition to providing certain of these services. So the law has a very narrow exception for church plans. Church plan is a plan that is a church, okay? So for the ministers, the people that work for the church, they are exempt from this law. But as we know, so many organizations, hospitals, universities, colleges, charities are associated with and have the religious tenets of whatever the religion is, but they serve all kinds of people. They hire people of all faith. That's the universal aspect of kind of religion. And these plans would have to comply. So the point here is that these issues are being challenged in courts. The court issues are not finished yet. There are a number of court challenges that are still going on with this law. So just be aware that there are still possibilities for more modifications of the law via the courts, not just Congress. Next thing that is right upon us is a requirement to provide a summary of benefits and coverage. It is, I don't honestly understand why, I don't understand the why of this, except to increase cost. I know what they say. The SBC, the Summary of Benefits and Coverage, is supposed to be a uniform document so that individuals can look at various plans and have common terminology, common language, so on and so forth, so that they can really do an apples-to-apples comparison among plans. Well, the problem is ERISA plans already have to provide a summary plan description, which is a summary of the plan. Very important because it's the rule book. But on top of that, participants are now going to get this additional document. Hopefully it'll be electronic, but it may be paper. We do like those trees up in Oregon and Washington. We don't want to kill too many of them. I don't know. I think the idea is good, but in practicality it's just going to be confusing to people because the summary of benefits and coverage may not actually represent the particular plan. It's examples. It's generic examples. So I don't know. I don't see it on the SBC, but nevertheless we have to comply. And if you're an employer, you need to make a good faith effort over the next year. I get a lot of questions about, we can't do it. We can't do it. Well, at this point, the government is saying it's the kinder, gentler world. They're saying we know. We also have been given a huge amount to do. So what you need to do, employers, is make a good faith effort. Don't ignore it. Do your best. Next thing we want to talk about is a W-2 requirement, which is also coming up based on 2012 information. You need to make sure if you're an employer that all of your payroll systems are collecting information. It is not a tax issue, it's a reporting issue, but the aggregate cost of employer-provided coverage, so the employee and the employer's share, has to be shown on the W-2 that is due to employees in 2013. If you file fewer than 250 W-2s, you don't have to do it until future guidance. But otherwise, you have to do it, and you have to reflect changes. So you can't just look on December 1st and say, what did somebody have? You have to track their coverage through the year. If they went from single coverage to family coverage, you have to track that and reflect the entire amount. Next thing that's coming up is a patient-centered outcomes research fee that will be assessed. If your plan is insured, the insurer will collect this fee. It starts out as $1 per covered life, goes into a federal fund to fund research. If your plan is self-funded, you as the plan administrator have to collect it. It will go up to $2 and it will sunset in a number of years. So just be aware that that's coming up. The first payment will be due next July of 2013, but based on your plan year that ends after September 30th, 2012. We change these dates all slightly just so I have to stop and think what the date is. So if you have a calendar year plan, it would be based on your 2012 calendar year. Also coming up, if you have a flexible spending account, you need to reduce the maximum salary reduction that your spending account will allow to $2,500. Historically, flexible spending accounts haven't had any kind of limitations, but it will be limited going forward. So make sure that you look at your plan and get it modified accordingly. There are a number of reports and notices that we have no guidance on yet, so we're going to skip over them. Just know that they will be coming. Let's talk about now this 2014 issue, which is now quickly upon us. This is collectively the shared responsibility period in our history. As we've alluded to, individuals will have to maintain a certain level of coverage. Okay, they'll have to prove that they have minimum coverage, or they'll have to pay a tax. The tax is very small. So I think that's a bit problematic. It does go up over the next several years, but it starts out very small, and even as it grows, it's still significantly less than the cost of health care. So if our goal collectively on this law is expanded access, you got to wonder. Though Massachusetts, the state of Massachusetts, did a similar kind of law a number of years ago where all Massachusetts residents have to maintain a certain level of coverage or pay a tax. The lesson from Massachusetts is it has in fact expanded coverage. It has also expanded the cost of health care. So we've got to bear that in mind. We've got to look for ways to control the costs of health care. The employer obligation in this shared responsibility world applies to employers who employ 50 or more full-time equivalent employees. This piece does not apply to smaller employers, but what you have to remember is in determining whether, as an employer, you're subject to it, you have to add up all your part-time people to get what's called a full-time equivalent. So if you have 50 or more full-time equivalent employees, there's a possibility that you could be subjected to an excise tax. You don't have to offer health coverage. The government didn't mandate that you offer health coverage, but what they said is if you don't, then you're going to pay. And so how, as an employer of 50 or more full-time equivalent employees, could you have to pay? There are two ways, really. One way is that you don't offer minimum essential coverage. Again, we don't have a clear definition of minimum essential coverage, but basically what we believe is that it's going to be any comprehensive health coverage will qualify as minimum essential. So any employer plan that isn't extraordinarily catastrophic will comply with the minimum essential coverage requirement. These so-called limited medical plans that provide very, very minimal coverage won't comply. They, at this point, probably won't have a viable life after 2014, but of course that could change. So if the employer doesn't offer coverage to employees working 30 or more hours per week, and this is a big issue because many employers offer good quality coverage, but they only offer it to people working 40 hours per week or 35 hours per week. This law changes the rules and says 30 hours per week. So if you don't offer coverage, adequate coverage to people working 30 or more hours per week, and if one of those employees goes to the exchange that the state will have established, and the exchange says, okay, Joe, you worked, does your employer offer you coverage? And Joe says no. And then the exchange says, okay, Joe, where do you fall in the poverty guidelines? And they look at that. They haven't quite figured out how they're going to do all that, but they say, okay, Joe, you fall below 400% of the poverty guidelines. Therefore, Joe, you qualify, or I should say you fall between 133% and 400% of the poverty level. And I'm going to talk about why that's a problem in a minute. So, therefore, Joe, you qualify for premium assistance from the government. Your employer doesn't offer you coverage, and you fall below or between 133% and 400% of the poverty level, so you get a cost share premium assistance so that you can buy coverage through the exchange, through this marketplace that we offer. Now, who's your employer? And then they go to the employer and say, employer, you didn't offer Joe adequate coverage, or you didn't offer him any coverage. Therefore, employer, you are the lucky winner of a penalty. It's an excise tax, and it's non-deductible. And the penalty is determined based on all of your employees who work 30 or more hours per week. We don't care if you, well, and again, some of this is not defined yet, but what we believe it's going to say is, we don't care if you offer a certain group of your employees coverage. You didn't offer it to Joe, who works 30 or more hours per week. Therefore, your penalty is, as determined on an annual basis, $2,000 times all of your employees who work 30 or more hours per week. But we'll let you subtract the first 30 employees. Okay? So if you have 100 employees that work 30 or more hours per week, and one of them qualifies for premium assistance through the exchange, you subtract the first 30, multiply 70 times 2,000, and that's your annualized penalty. It's actually determined monthly. Okay? That's one way that you could be penalized. So if you offer inadequate or no coverage and somebody qualifies for premium assistance, you could be subjected to that penalty. The other way that you could be subjected to a penalty is you offer good coverage. Okay? You offer good coverage, but it's expensive. Okay? So Joe goes to the exchange, and the exchange says, okay, you've got coverage, it looks good, how much does it cost you? And Joe says, it costs me more than 9.5% of my household, or, well, my household income is what the law says. What we believe, the government has sent up some trial balloons that suggest that the employer will be able to use W-2 earnings, because there's no way employers can know household income. That would violate all kinds of privacy issues. So we believe that the potential for the employer to be penalized will be based on W-2 earnings, whether the cost of coverage is more than 9.5% of single coverage. And that is an issue that is causing much angst among some, because what that could mean, if in fact, and again, we don't have regulation on this, but if that's the way the rules are written, that means that employers could put all of their dollars in the individual basket and have employees have to pay all or most of family coverage. And in that scenario, if Joe went to the exchange and the exchange sees that the individual coverage costs him less than 9.5% of household income, he would not be qualified for premium assistance. Conversely, if Joe earned more than if the cost of the employer coverage was more than 9.5% of Joe's W-2 earnings for individual coverage, he would qualify for premium assistance, and the employer would be subjected to a penalty equaling $3,000 on an annual basis, but only times the number of Joes. So only times the number of people who qualify, go to the exchange and qualify for premium assistance, which means fall below 400% of the poverty level. So if you have a workforce that is, in the service industry, if they're lawyers, if they're, medical professionals, whatever, you're not going to have that many people that fall below 400% of the poverty level, but you could have some. So those are the two ways that an employer could be subjected to a penalty. So the things that employers need to look at as they go forward, as they are making this decision about whether they want to pay the excise tax, or if they want to provide coverage, they need to look at their population. How many people work 30 or more hours per week? Do we offer coverage to that group of people? And is it affordable? Is it, for single coverage, going to cost them less than 9.5% of their W-2 earnings? And then the one other thing that many plans will have to change is the waiting period. In 2014, the maximum waiting period that any plan can impose is 90 days. We don't have guidance yet on what this is going to mean, but indications are it's going to be a strict 90 days, not first of the month or next quarter or something like that. And many employers have much longer waiting periods, particularly for certain groups of people. So that's going to be problematic. What we hope in guidance, and again, the government has put up several trial balloons on this, is, you know, you're thinking, particularly if you have a workforce that's very fluid, you know, that maybe is in construction, in restaurants, in, you know, seasonal, that kind of thing. What we hope is that there will be a look-back period whereby you look back to the previous X, whatever that X is going to be, 3 months, 6 months, 1 year, to figure out whether somebody has worked 30 or more hours per week. And if they have, then that person would be deemed to work that amount of time for the next X. So kind of you look back and the person qualifies for the look forward, and then you look at that period for the next look forward. It's just untenable otherwise. So we hope that that's how that works out. But that's kind of what employers are going to have to be looking at going forward.